My title is a master's in clinical psychology, which I got from Antioch University, a great place. But my specialty is grief recovery, and I'm a certified grief specialist. And the reason that I have picked that niche is because so much therapy is remunerated by managed care panels in the state of California for what's called behavior modification, cognitive behavior therapy, CogB, CBT, which I don't think taking responsibility and just talking about what happened and taking a walk in nature is going to solve deep-rooted loss and grief issues.
Can you please explain what the grief recovery method is?
Yes, it is Sonia, a step-by-step method to finish an unfinished loss, to rediscover joy and happiness and more energy and more presence in the present moment. Now, we hear that all the time about got to be in the present moment. Don't live in the past, don't live in the future. You never hear how to do it. I think we all agree with that. How do you do it? I've never seen anything else work as effectively to finish what was in order to live with what is.
Oof, you're so good. I'm so glad I met you.
Oh, sweetie.
Really, I mean, I can't tell you how many times I quote you just in dealing with my friends. For me, I had a lot of therapy and a lot of that sort of knowledge under my belt before
Yeah.
I came to you.
Yeah.
And I wondered if it's most effective that way or if I had no clue. I've never plopped myself in a therapist's chair. I've never read any self-help books, never done any of that other stuff that I've done.
That'd be better.
Really? Okay.
Because when I was trained, they really picked me to be one of their star guys. Why? Because I didn't have any training on
Oh.
anything.
Oh.
I'd never been to therapy, never had any training. I got the master's later. And they're like, you're perfect for grief recovery. We don't want these therapists coming in. It's so hard to unlearn them.
That's true. That's with so many things.
Clients are a little that way too.
Yeah, I bet. That's with so many things. How long have you done this? You may
But,
have said that. And how did you come to this profession?
but listen, I'll give you an answer on that if you want to record it.
I'm recording this whole thing.
Oh, I'm sorry. I would have given you a better soundbite if
No,
you
and I
want.
think no. Oh, well, give me a better one if you got a better one.
Okay. Well, you're asking about is this the last house on the block? That was your experience. I remember you saying that clearly, Sonia, like it was yesterday. Two things. Number one, some people think, is it too early to do my grief and loss work? Do I need to go and try other modalities and then wind up in grief recovery last? My usual answer to that is, well, if you fell down and broke your arm, and God forbid there's blood coming out and it's broken, is it too soon to go to the ER? No. So in the medical model, it's not too soon to work on a broken heart. If you get the idea that behavior modification is not going to solve a broken heart, things that want to be different in here, things that are wrapped around resentment that need to be coughed up like a cat, like a fur ball, that kind of stuff, better thinking, and joining a yoga class, again, not to minimize those things, but they just are not powerful enough to address the needs of the heart, which is wanting yesterday to be different or better or more.
And what I've learned from you is that it doesn't have to be. You don't have to take your course to heal a from a death or that sort of loss. It can be.
Good point. Good point. I don't even like the word grief. I like the word loss because yes, it's loss of a loved one, death, absolutely, but it's loss of a relationship. It's breakup, it's divorce, it's moving, it's menopause, it's retirement, it's loss of trust, which seems to run through every loss to some degree.
Right.
Loss of safety, loss of finances, moving, death of a pet, purest example of unconditional love in the world. And there's so many types of losses. In fact, they've done studies on this, 42 different types of losses, 42 different types of losses.
Wow.
And death is not in the preponderance of those at all. So
Wow.
loss, I think, is better than grief.
Yeah. And for me, it was loss of a relationship that was hoped for but never realized.
Well said. Loss of hopes, dreams, and expectations.
Oh, yes.
What might have been. This is not what I signed up for. This is not the way life is supposed to turn out.
Right.
So then we start to get into what if I never meet someone as wonderful as he was? What if I never meet someone as beautiful as she was? What if I wind up alone. And a lot of fear is generated. And from that fear, we have anxiety. We call it depression, and we call it anxiety, unresolved loss,
Okay.
unfinished business in a relationship with someone living or not living, is my view on what's really going on. Not just slapping a label of anxiety and depression on it, then go see someone for a pill. And then life gets pretty gray and flat.
Right, right.
There's an alternative.
That sort of brings me to my Father's Day theme. I mean, we can experience a loss of a relationship with a father for many reasons. He could be an addict and not emotionally or physically there. He could be incarcerated, be
Right.
many things. So
Many
what are
things.
some of those coping skills that you see that we do that aren't helpful at all? I know when I came to see you, I thought that I had resolved my lack of father thing by just going, it is what it is. And I
Yeah.
thought, I pulled on my big girl panties and it is what it is, whatever.
Right.
So what are some of those other things that you see in people that they do that they may not, they think that they've got this handled? I had a woman friend recently who goes, well, that's just the way I am and it's all over with and that's it is what it is.
Oh,
It's
and
heartbreaking.
it's heartbreaking. Well said. And then you see a little kitty walk by the TV screen at Christmas time, and you start to tear up, and you feel those feelings right here, and we stuff them back down. Or someone cuts us off on the freeway, we want to rip their throats out. It's like, where is that coming from? Reactions become disproportionate. What that's telling you is there's a lot of stuff that we'd like to push away, we'd like to stuff down, we'd like to numb ourselves, we'd like to open the freezer and start a relationship with Haagen-Dazs, and hopefully that's going to solve our problem. Drugs, sex, and alcohol, Netflix, all these things. Meanwhile, we have this heart that I keep going back to. That's like, somebody listen to me.
Right.
We don't know how to navigate our emotional landscape at all.
Right. Now
We're
with
taught to acquire things. If I can just acquire things in life and get my head around what happened and figure it out and get my questions answered, then I'll feel better. But you
right.
can't hit your heart with your head.
Right.
Think yourself into feeling better.
Right.
No.
And with men, some of the things that you're talking about symptomatic of men, the anger maybe, or stuffing down crying because men aren't supposed to cry. They're not supposed to show their emotions. They're not supposed to even be in touch with their heart. Is it harder? Do you see less numbers of men than women coming in for
Absolutely.
therapy? And how do they differ in how they handle how receptive they are and how they handle your therapy?
I would say in 25 years, almost 26 years of doing this, the person I helped, I don't like the word client, but the person I helped about 15 years ago, go from absolute minus 60 to plus 60, and I use 60 because it's like he was a Harley rider,
Okay.
all fatted up, long hair, dude, and I have never seen anyone go from that level of shutdown to that level of just freedom. Never seen it before or since with a man or a woman.
Wow.
So I don't know if it has to be gender specific, although you're right, about 20% of my clients are men and 80% are women. And
And of
often,
those 20, I bet they're being dragged in by their women.
that's right. And I have to say, most of my clients are women in their 50s. Why is that? Because in your 20s and 30s, the drug, sex, and alcohol still seems to work. You can raise the skirt a little bit, drop the top a little bit. That's still, you can outrun it. But then, I don't get a lot of 80-year-old women. I've maybe had 5, and they come and pat me in the head. You're a nice boy. But women in their 50s and 60s, it's a sweet spot. I have got to deal with my stuff. None of that stuff works anymore, and I have a lot of life left. So at some point, I have to stop. And how many more years are we going to shovel this stuff away and shove it away because I got to go to work?
Right.
I got to deal with this. I keep dragging this stuff from my old relationships and throwing it into my new relationships and wondering why they keep ending up the same way.
Right.
I got to do something about this. I got to melt this snowball of unfinished business, work through something, and create some better choices that I can make instead of that stuff choosing for me.
Right.
That stuff tends to separate us from ourselves.
Right. That's very good because that's the explanation I just recently heard from someone is that stuff was really ruling her. When it came down to it, it was too hard to try to fix it, and it was easier to own that stuff had her. It It just, like I said, it is what it is.
And then we attract people that are at our same level of dysfunction. We're taught, in clinical, classes and things like that. But it's baggage meets baggage is what that devolves down into.
Wow.
Yeah.
Okay, you have a wonderful relationship with your daughter. Is it daughters? I think it's daughters.
Yeah. That's right.
Yeah.
I
And
did.
did you get that from your father? How did you learn that skill?
No, I did not. I just don't have a lot of empathy for people who say, well, I don't know how to really do this or do that in life because I wasn't taught to do that. I don't have a lot of empathy for that. And so I asked them if they're a plumber. Were you born learning how to fix pipes and things? No. What'd you do? I went to school. Oh, so you learned how to be a plumber? Yeah. Why don't you learn how to be a dad?
Ooh.
Learn how to be a husband. There are things you can do to educate ourselves. I don't like people who hide behind the, well, you got to understand, my dad, and he didn't teach me anything, or I didn't have a dad, or he was absent, he worked all the time, and well, go figure it out. So that's just what I did.
Right. Didn't have any role models. I just remembered something else you used to say, and I still, you know what? I got it one day, and I lost it again. But you said the person who I was working on at the time, you said, what if you discovered that they were perfect just the way they are? And I'm like, they're not. And they didn't do the best they could. I still have trouble with that thing too, as they did the best they could. I'm like, that can't possibly be, to be such a horrible parent. How could that be the best you could do? And how could I see that as perfect?
Well, here's the answer if you can read between the lines.
Okay.
Very abusive, neglectful father. Here's what I'm telling you straight up. My dad is perfectly wonderful the way he is. We have the best relationship in the world now, and guess who changed? Me or him?
You.
That's the answer.
Mm.
The only way out is to accept people for how they are. The worst people in the world are perfectly wonderful the way they are. And that's really a challenge for people coming into this work.
It's really a challenge, but I thought that I lost it, but now that you said that, I do have that. Because some of the people who are coming in my life right now, not only can I accept them for who they are, but I can also accept if I want to be a part of that that icky vortexy world of theirs and get sucked down into it without feeling guilty or angry or any of that stuff. So well I guess said. I am getting it.
Well said. And you find yourself going out of the moment and getting your buttons pushed. It's like, oh, I have tools and skills now from that little grief recovery method to get back into the moment where happiness is. There's no happiness in stuck in regret.
Yeah.
There's no happiness in the future and loss of hopes, dreams, and expectations like you were saying.
Yeah.
It's only in the moment. What if I need a tool to leverage myself and crowbar myself out of those areas when my buttons get pushed by this person or that? You realize, whoa, let me stop here.
Right.
Okay, I got a little bit of communications I need to make. I have a few more communications I need to make. That sounds better.
Right.
To get back, because we have tools to get back. Can I say something about this?
No. Yes, of course you can. And stop moving because your camera's moving all over the place when you move. Is it on your lap?
It is.
So every time you move, it's going nuts, but it's okay.
I like that. I'll be more mindful.
Yes. You're so animated, though. That's one of the reasons that I really, really liked you in your course. So you're just so fun.
Yeah, I'll do better. Sometimes people come in and they start to bite off on this concept that if I just give it time, if I'm strong for son, sister, mother, dog, cat, if I just try to focus on the good things, if I keep real busy,
right,
then I'll be fine. And they realize sometimes after a year, wow, it didn't work. I feel worse.
And you're exhausted.
And they're exhausted. And they're not in the moment. And there's pain. And they're overreacting. And they start to leak. And it's like, man, I can now, and once they come see me, something like me. And I was like, they're just afraid of risking in relationships again. Let's talk about a divorce or a breakup. And so I asked them, I think we all want to know and be known by another human being deep down. We may not admit it. I think we really do want to know and be known. That's just called that healthy intimacy. I think there's only one way we can get to intimacy. And that word starts with a V. Not Viagra, like this guy in my group said.
That was my first guess.
What's the word?
I'm out of it.
Only door is vulnerability.
Oh, that's right.
Oh, I can't be vulnerable. You don't understand. I've been hurt. Oh, but I want that
Yes.
so
I
much. It
hate
radiates.
that V word.
Yeah. What if you had a set of tools and skills that in the event you get hurt again, and there's a 100% chance you will, wouldn't it make you less afraid to risk?
Yeah.
I can use my skills, my
Yeah.
tools, and get back to the moment where happiness is in choice and spontaneity and intuition.
Wow. It's funny though, for me, I go back to that same go-to place that I went to before you, and recently I was just ruminating over something, and I went, what am I doing? I have the skills to at least try to do this the way you taught me, and I did, and it was done. It was done. Now, one of the things that I love about grief recovery is that there, and I don't know if it's just yours or if it's all of them, but ours was a 12-week course. It's not like a therapist is going to take your money for the rest of your life.
Right.
12 weeks, boom, you're done. And it culminates sort of in this letter writing thing, but it's not like the letter writing campaign that I see in other therapy. You know, you burn it or you ball it
Yeah.
up and throw it, and boom, it's supposed to be gone. It's not that at all. And so recently I pulled out a pen and paper and I did this, and it was
Well,
very, very effective. But I did want to pat myself on the back and thank you that I was able to write that letter.
that's a really good thing. And, sometimes if that seems a little less curative or therapeutic than you would hope for, then that means you need to read it to someone. Because grievers aren't broken, they don't need to be fixed, they need to be listened to, they need to be heard with dignity, honor, and respect. So it's very tough to find people who are non-evaluative and just were open and accepting, and we can just tell them whatever we need to tell them according to the structure of this very specific structure of this letter. That's not just writing about what happened. Most people who come see me realize, wow, just
Right.
talking about what happened is not enough,
Right.
and
Right.
crying about what happened not enough. But there's nothing that's enough. So this letter is. It's a lot of work to get there, but once we get there, it's very structured, as you know.
Well, that was the other thing is I was very I'm probably more in touch with my guy side, and I was very skeptical of this. It probably took me to week 9 or 10
Yeah.
where I finally the light bulb went off on my above my head, and I went, I see where you're going with this. This is pretty cool. I mean, I was totally impressed because up until then I'm going, where is this getting us? What is, and then I'm going through all these other emotions,
Yep.
but I didn't see how it was related to the final culmination of what we did.
Yeah.
And boy, was that interesting. It must be great to practice a form of therapy that's so effective.
It is. It is to see the rewarding thing. You spark something there. A lot of people come in with, I say I've never met someone who had a perfectly good life and then someone dies or someone leaves. Not yet.
Right.
Instead, it's from the earliest ages. Loss on top of loss on top of loss on top of loss on top of, and the proverbial straw breaks the camel's back. These losses are connected, okay?
Right.
And a lot of them start, the table was set, the table was set, the foundation was laid. The genesis is from early childhood.
Uh-huh.
And it's all kind of the way we didn't cope then is the way we didn't or don't cope now. And things don't change much. So then this work is really cool because around 4 or 5, you sort out which loss I'm going to get the most bang for my buck in the next 10 or 12 weeks. I do one-on-ones for 10 weeks.
Right.
And sometimes that you had some other thoughts and feelings you said going on. You just said there are some other losses that get involved there, so we have to keep them separate. We'll get to that loss, but right now we're working on this one.
Right. I got a
One
whole
by
list.
one.
And I started off on the one that I thought I could never get over. And you said that's the one to do.
That's the one to do.
It was an interesting journey. I hunted around for a grief recovery therapist on the internet. I read everyone's profiles. I was drawn to yours, and I'm very happy that I did. What should people look for? Additionally, on top of everything you do, you're energetic, you're knowledgeable, you're compassionate, all that stuff. But you're a prayer warrior, and I don't know that you would consider yourself that because one day I said that to you, and you kind of blushed or whatever. But one of the highlights of my sessions with you was your prayer at the end. And is this a Christian-based therapy, or is that something you bring to the table?
It's something I bring to the table. Now, if there are non-believers there, I don't start talking about Jesus this
No,
and Jesus
right.
that.
Uh-huh.
Okay, so I'm pretty sensitive to what,
Yes.
even if people don't believe, most people believe Jesus was a good teacher, if not God himself. So there's no problem with that.
Right.
So I'll bring in different spiritual things and to try to build a bridge wherever we can. I'm not trying to convert anybody or even get anybody to Jesus.
Right.
It's just part of
Right.
who I am.
And our sessions were held at church, so you probably, and I remember you asking if everybody was, if this was good for everybody, and
Oh, okay.
by far it was great with everybody.
Oh, wow. Okay. Yeah.
Yeah. So just so you know that. And so what should people look for in finding a grief recovery therapist?
You said knowledgeable, and I'm always going to push back on that. I don't think people care what you know until they know that you care. So I have people say, I'm going to have my sister, mother, brother, kid talk to you, call and talk to you. It's like, just have them sit down with me for 30, 40 minutes, no charge, no pressure, no commitment, and we'll just be two human beings, eye to eye, heart to heart. And at the end of that time, they'll be really clear. This is for me or it's not.
Right.
And you can be the judge and decide for yourself. Do I feel like the guy gets me and there are some resonating things there, or is he just trying to like speak at me and be didactic? Because me just talking to someone's not going to get them better.
Right.
And me sitting back and say, how does it make you feel? Well, it's not going to help either. It makes you feel like crap. What are we going to do about it?
Right.
So probably get 9 out of 10 people who come to me, go ahead and enroll. But it's not an agenda. I just try to bring what I bring, and sometimes it doesn't fit, but it's rare.
Rare, yeah, I could see that, and I could see that would be a great way to start. I've gone to so many therapists where I'd say 15 minutes of their free 30 minutes was talking to me about what kind of insurance I had.
Oh, I had somebody that's terrible. Somebody this week said, well, they had a horrible accident with one of their family members. And the therapist, I said, so what did the therapist tell you? I'd be really interested to hear. Oh, it was terrible. Well, what happened? And the therapist kept just saying, oh, how raw. How raw. And the first 5 or 10 times is fine, but for an hour I heard how raw. And it's like,
yes,
that's telling.
Yeah, I've seen the gamut. I've run the gamut of therapists who probably shouldn't be. Should be in therapy. Let me just put it that way.
A lot of us go in to be trained as therapists because we were trying to work out our own issues.
Yeah.
So I do like how most of the programs, at least in Southern California, force you to go to a therapist and work on your stuff. So that's a wonderful thing. They built that into it.
Okay, good.
I don't know, how those cognitive behavior therapists that therapists go to are going to solve deep-seated.
Yeah, I've seen more marriages blow up behind marriage counseling, Just the wrong counselor.
The studies show, sorry to interrupt, that the reason marriage counseling fails most of the time is that people go too late.
Oh.
That's the study.
But they're not going to go when they're happy.
They should at the first little crack.
But what is the crack? A crack isn't arguing, is it? Or is it a crack something bigger, like an infidelity or, betrayal? Or is that a little crack, or is it... He doesn't put the toilet seat down.
Yeah. I'm having a hard time accepting the way you are.
Ooh.
Because when you come in and you want a beer and you put your feet up, I need to talk about my day and have you help with the kids. Now, I've talked to you about this. I've asked you for this, and you either one or two things. You say go to hell, or number two, you agree. You understand, but nothing changes.
Right.
So would you be willing to go and talk to a neutral third party, a coach, a counselor, and maybe he can give us some tools and skills where I can get my needs met? Would you be willing to do that for me?
Right.
You say something else. For a lot of people, you say the end of the road. For a lot of people, this is the start of a great journey for them. For many people, they may have been to a lot of therapists, and maybe this is 911. This is the last stop. If this doesn't work, and this is how life is played, I don't want to play anymore. I mean, I like people like that because I know that I can help them. But that starts them on the path, and they start getting into other things like mindfulness, or they start going to workshops, or in AA starts to work, and these different things when you get the weight on your neck off. So I like how it can launch people into get their sail that's been up and down on the waves, and then I don't know if my hands are going to mess this up here, but it gets up and it dries off on the shore, on the sea, and they tack toward that distant shore to wherever they need to go. So I don't help people get to that distant shore. That's not my area, but I'll make sure that your sail is dry and you're ready to go.
Oh, that's good. And you do. Thank you for coming on. I've been wanting to interview you. This has come about. When I met you, I was like, if I ever get back to doing Sophia Unleashed, if I ever get back to doing something like this again, you're the guy I really want to interview. So thank you again for coming on. And I'm going to edit this into 2, and I'll let you know where you can see it when.
How nice. Thank you. It's a privilege for me.
Thanks. All right.
All right.
Talk to you soon.
You bet.
Okay, bye.